I'm Taylor Colvin. I'm an ear, nose, and throat surgeon at Valley Medical Center. I chose my specialty even before medical school, which is kind of rare. I always knew I wanted to do surgery. I always liked doing things with my hands. And as I researched the different surgical specialties, I found that ear, nose, and throat had a great variety of different things. You do different things on the bony skeleton, you do things with nerves, you do things with soft tissue, you treat cancer, you treat pediatrics, you do all sorts of different things. I feel like a lot of people think of ear, nose, and throat surgery as tubes and tonsils. But the great thing about ear, nose, and throat is I like to think of it more as head and neck surgery. Basically anything that's not the brain, the eyes, or the teeth, we treat in ear, nose, and throat. I treat thyroid cancers, for example. A lot of people don't even know that ear, nose, and throat treats thyroid cancers. And thyroid cancers makes up a pretty good part of my practice. I really enjoy doing thyroid cancers and salivary gland cancers and things because a lot of these cancers are very treatable. The part I like most about my job is that I do surgery once a week and the rest of the days is clinic. And I really like that aspect of it because I like that mix. I like doing surgery, and that's a big reason why I chose ear, nose, and throat. And I also like being in the clinic and talking with my patients, getting to know them and talking with them, getting to know their families. My philosophy of care really centers around respect for my patients. If I respect my patients, that really kind of encompasses everything I need. It helps me have compassion towards them. It helps me give them a platform to stand on when they're talking to me and not feel like I'm just rushed in, throw some medication at them and walk away. It really gives them the opportunity to speak their mind, tell me about all their different symptoms because most often they're connected. And if I just treat one little symptom, then they're going to come back next month with more symptoms. I always like to involve the family in their care, especially the family that they bring in with them, because those tend to be the family members that are closest to them, that they trust. And a lot of times they bring in those family members to help them understand and guide their treatment. And if I don't involve them, then why did they even bring their family members? So I always like to involve everyone in the room, make sure everyone understands, because as they leave my clinic, they're going to be talking about this treatment plan that we came up with. And if everyone understands it, we're all on the same page, then that is what is really helpful for these patients. I really enjoy working at Valley. Valley really does respect patients, and that's really why I chose Valley, because everyone seems to have that same philosophy that I do. Everyone has this kind of family-oriented patient care where we all want everyone to feel at home here, and all my other partners are also that way, and all the staff members are very caring towards patients, and I really like that aspect of Valley. Outside of work, you can either find me at the top of the mountains or the bottom of the ocean. I like to stay active. I like to rock climb. I like to scuba dive. I like to do everything in between, including hiking and camping. And most of all, I like to spend time with my family. They are what drive me, what motivate me. I always like to spend time with them, and that's what keeps me happy and in a good mindset to treat patients throughout the week.